Hey everyone. When we're checking for fertility, there's a large group of tests we want to look at. A lot of them are tests that may be overlooked in baseline fertility testing. So we're looking at like additional modifiable um, causes of infertility and additional modifiable risk factors. So things that we're able to change prior to fertility treatment to potentially help improve our chances, which is what a lot of patients that come, book a consultation with us are looking to get. And really interesting research published in the past couple of months. So there's two very valuable hormone tests that were found to be more likely to be abnormal or higher compared to patients that have fertility, have confirmed fertility, and don't have issues conceiving. So basically, the two hormones we're looking at are prolactin and cortisol. Prolactin is a hormone that's produced in the pituitary gland of the brain, and prolactin is kind of like the stress hormone for the nervous system. So it usually goes up in periods of high stress. It could be psychological, emotional, physical. So a lot of like athletes, marathon runners, triathletes, etc., will tend to have higher prolactin levels. And if cortisol is high, cortisol is a hormone produced from the adrenal gland. The adrenal gland sits just on top of the kidney, and the sympathetic nervous system, when it's active, the sympathetic nervous system is what drives that fight or flight response. It actually releases or signals the adrenal gland to release more cortisol into the blood, and that cortisol from the blood will reach all tissues, so the heart, liver, brain, and also the reproductive organs. So we're looking at the correlation between uh, cortisol, prolactin, two hormones that are associated with elevated levels of stress and declining fertility. So this is very valuable because I think a lot of patients are told that stress doesn't have a lot to do with fertility. And it's true that there aren't very powerful studies studying the impact of stress on fertility and reproductive outcomes, but we're seeing a lot of early studies, and we know the physiological impact that some of these hormones have on reproductive function. So, for example, the hormone prolactin, when it's produced, it actually suppresses the production of two important hormones, which are FSH and LH, also produced from the pituitary gland. But the suppression of FSH and LH actually decreases the production of estrogen, progesterone. It can decrease the quality of ovulation. And ovulation, I always like to share with patients. Ovulation isn't an on or off switch. It's not something that it happens or it doesn't. It's actually like a spectrum. It's a scale on good quality ovulation to poor quality ovulation. So even if you ovulate, the quality of the egg that's released, the size of that egg, is it, at its maximum maturity of almost 2 centimeters in diameter? Is it fragmented? What are the progesterone levels that are being produced after ovulation, the estrogen production after ovulation? All of these factors play into something that we label as quality of ovulation. So many patients actually have regular ovulation, but the quality of that ovulation is not very good, which is exactly what we're seeing in this research. So in the group of patients that had infertility, and we saw that they were much more likely to have higher levels of cortisol throughout the cycle and higher levels of prolactin throughout the cycle, also tend to have lower estrogen levels throughout the cycle and have a lower LH surge to help with good quality ovulation. And estrogen has a very important role in the growth of the endometrial lining, and so it supports implantation. And same with the post-ovulation phase. So after implantation occurs, estrogen and progesterone are both required to maintain the integrity and to maintain that cycle, and to maintain the lining, so you don't get your menstrual flow and lose the implanted embryo. So it has a very important role in supporting fertility and pregnancy. And prolactin and cortisol suppress the production of estrogen. So when we're looking at patients who are under high amounts of stress, and like we mentioned, it could be psychological, physical, emotional. Stress comes in different packages, looks different for everyone. But physiologically, when we look at it, the blood values don't lie. So if cortisol seems to be higher than where it should be, we have to consider the impact, the negative impact that it might be having on reproductive outcomes. So, this is where mindfulness-based exercises, meditation, a lot of these meditation apps that you can now download right onto your iPhone or Android device are so valuable because just a short amount, like 5-10 minutes a day of meditation, have been shown to potentially improve IVF success rates, pregnancy rates, and they've been shown to reduce the levels of some of these hormones like cortisol, particularly. So it's a important treatment tool we have at our disposal, which costs very little. Maybe your subscription fee to some of these apps, and it really just takes 5 to 10 minutes of your time. And I know patients always tell me like, "Oh, I'm so busy, I don't have time to sit down and meditate." And I always tell them there's that funny saying that everyone should be meditating at least half an hour a day unless you're incredibly busy, and then you should be meditating an hour a day. So, the I think what it comes down to is carving time out and being consistent with our self-care. So carving time out in your day that, is targeted for you to excel, targeted to help you feel better, to help improve productivity. And it's kind of like an investment in everything for your day. If you're feeling better, mood's better, stress levels are lower, sleep is better, then work productivity is also better. So, it's a small investment and really not just for fertility outcomes, which is the main reason we want to do it, but also for many aspects of your life. So, in addition to doing the mindfulness meditation when stress is high, we also look at other therapies that can support the reduction of cortisol and the feelings of anxiety or stress. And sometimes it comes down to different micronutrients, different herbal formulas which have been studied to help reduce feelings of stress and anxiety, such as adaptogenic herbs, which can help to basically improve the resilience of the mind and body to stress, especially chronic, consistent, elevated levels of stress. So I find patients usually have the feedback that once they're on these treatments, they feel like the stress is still there, but they don't feel as nervous, anxious. They don't get the heart palpitations as much. They feel like they have better energy. So we're looking at a lot of these treatments to help, work together in a uh, you know, uh, synergistic role together. So, herbal micronutrients plus lifestyle changes plus things like meditation and mindfulness, how they can support each other with the same end goal, which is to help you feel more relaxed, balanced, and centered. So it's just an important reminder that when we're working with fertility, we can't overlook a lot of these big, important feelings or our state of being in our day-to-day being. It's in our day-to-day life. It has an impact not just on how you feel, but also potentially on your reproductive outcomes. So we use this as an excuse to help patients um, reorganize or reprioritize certain things in their life, so they can help get pregnant. But once they feel better, many of them, keep up with a lot of those changes anyways. So if you're working towards a fertility treatment or trying to get pregnant, it's important to look at a lot the role that cortisol and prolactin can have. And it's important to mention, in this particular study, what we're looking at is a correlation. This is not an exact causation, but based on a lot of consistent early studies, we're seeing a very similar trend, which is activities that help to lower stress, lower cortisol, lower prolactin seem to improve reproductive and sex hormone production, may improve conception rates, may support pregnancy. And when these hormones are elevated, we're seeing a similar trend, such as cortisol and prolactin, when they're elevated, like this in this study, that conception and reproductive function may be impacted negatively. So work with your healthcare provider, work with your naturopathic doctor to help look at other strategies to help you manage that cortisol stress and elevated prolactin if that is an issue, or to have it tested if you haven't, and to discuss what may work for you.